CVS, or chorionic villus sampling, is a way to test for the baby's chromosomes in the first trimester. And CVS can be done somewhere between 10 and typically done between 10 and 13 weeks. It can be done all the way up to 15 weeks, but typically would not be done that way. So generally you do this between about 10 and 13 weeks. And what CVS involves is taking a needle or catheter either through the tummy or through the vagina to basically take a biopsy of the placenta. The approach that's done has to do with where the placenta implanted and where the baby's lying. And so whichever is a safer approach is the approach they use. So it's either a needle through the tummy or a catheter through the vagina that goes up into the placenta and takes a little piece of the placenta to be analyzed and to find the genetic makeup of the baby. The part of the placenta that's analyzed is the chorionic villus, and that's why it's called chorionic villus sampling. And so that's what CVS is. Now, how is CVS helpful? The big advantage of CVS is that it can be done in the first trimester. And so if there's a genetic problem, that can be found out a lot earlier in pregnancy. And if you're going to terminate, the termination is much easier with less risk. As opposed to amniocentesis, which isn't able really to be done safely till about 16 weeks. Because if that comes back abnormal, then you're talking about a second trimester termination, if that's what you elect to do. And that has a lot more risks than a first trimester termination of pregnancy. And so that's really the big advantage of CVS, is to be able to get the information earlier. The downside to CVS is that it has some risk, and there's about a 1% risk that CVS will cause a miscarriage. And if you compare that to amniocentesis, the risk of amniocentesis is about 1 in 200. So CVS has about twice the risk as amniocentesis of causing a miscarriage. The other downfall or problem with CVS is that CVS can have a false positive result. And what can happen is that it's possible for the placenta to have what's called mosaicism, where there's some of the cells in the placenta have abnormal chromosomes, but some of the cells have normal chromosomes. And even though the placenta has some abnormal chromosomes, it doesn't necessarily mean the baby does. So it's possible to get a result that shows, for instance, Down syndrome, but the baby actually is perfectly healthy, because you're not really biopsying the baby but the placenta. Now that's relatively uncommon, but it certainly is possible. So unlike amniocentesis, a positive result is a positive result. But with chorionic villus sampling, it is at least occasionally the case that a positive result, a result that says there's a genetic abnormality, actually the baby doesn't have that genetic abnormality, just the placenta does. The other problem with chorionic villus sampling is that there is a very small possibility of a false negative result. In other words, the CVS can say that the baby's fine when in fact it isn't. And this happens when biopsied actually maternal cells or the mom's cells get into the biopsy, and what's grown out then is the mom's chromosomes, which are normal. The baby, if it has an abnormality, in this case it would be missed. And so you've biopsied what you think is the baby, but it's really mother's cells, and those cells of moms come out normal, and the baby has a problem. And so that's the way that you can get a false negative result. Those are the big issues with chorionic villus sampling, and because of that, they're really done in fewer and fewer centers. Now, if you live in a big major city for instance, with a medical center or a teaching program, or somewhere that has a major perinatology center, for instance, if you live in Los Angeles, or if you live in New York, or you live in a big city such as that, CVS is going to be available. But if you live somewhere that doesn't have sort of the highest tech medical care, it's very possible that CVS is not even available to you. And the reason why is it's technically difficult, and that 1% risk of causing a miscarriage goes way up in the hands of someone that doesn't do this very often. And so you really have to have somebody that's very skilled to be able to do this. And unfortunately, those very skilled physicians aren't everywhere. So those are the problems with CVS. The big advantage is that it can be done in the first trimester and you can get the information early. The disadvantage is it has about twice the risk of miscarriage as amniocentesis, and it's possible to get false positive results, and it's possible to get false negative results, which is almost entirely unheard of in amniocentesis.
Medtwice.com